Arizona does have 3 counties that we're tracking very closely. Obviously, you know, the largest one being Phoenix and Maricopa County.
Yeah, that's not what we want to hear during a White House coronavirus task force. You were talking about us a lot yesterday. And Arizona's coronavirus cases are going up so quickly, the White House is paying a lot of attention to us. This morning, the county's medical director for disease control says the true number of infected people could actually be 10 times higher. Think of that. Imagine that. Later this hour, we're going to have team coverage tracking the latest numbers from Arizona officials and where you can get tested for free today, Scott.
Sounds good. Yet Arizona's surge comes just as we learned coronavirus cases across the world have now passed 12 million, more than 3 million of those right here in the United States. More than 550,000 people across the globe have died from COVID-19. Hong Kong had been winning its fight against the virus, but now it's reporting a surge in cases. Experts are calling one outbreak triggering 65 new cases, the city's third wave, and officials are warning that it could lead to an exponential growth in cases. Arizona is now ranked #1 in the world for the most spikes in cases, the biggest hotspot for COVID-19. The latest data shows ICU beds are nearing max capacity at 91% full. So we're getting a look inside one of our largest hospitals here in Phoenix to get an update on hospital beds, ICU, and the patient situation there. So we want to say good morning to emergency physician at Valleywise Health. We're talking to Dr. Murtaza Akhter, who's joining us live, and we talk to you quite often, doctor, so thank you for joining us. What is the latest situation at your hospital?
So, Scott, this is kind of what you've been hearing for a couple weeks now, if not longer than that. But basically, we're getting lots of patients with what we call influenza-like illness, cough, fever, shortness of breath, and almost every person I test comes back positive. Yesterday, I found my first case that I tested that was negative in many weeks. I've been saying for a couple of weeks now I can't get a negative test. And yesterday was the first time I found somebody who tested negative. So you can imagine how many people are coming back positive, even if they have slight symptoms. And a lot of these patients are getting admitted and we're running out of beds. And so we're having to manage a lot of patients in the ER. And remember, it's not just COVID. There are other conditions too. Heart disease didn't just magically disappear.
Right.
People still have gallbladder issues. They're still coming in. And we're really having to struggle to find places for them, especially when they're sick. We're doing our best, but it's gotten quite tough. And my colleagues at other hospitals feel the same way.
You know, we hear that the ICU beds and the beds in general are at near capacity. What would they normally be at if this COVID thing wasn't around?
So, you know, I'm at a public safety net hospital, as you know, so we're very used to dealing with limited resources, and we've gotten creative with that. We've never had to deal with something like this. We've already turned so many of our units into what we call COVID units. Our pediatric department merged with our adult department in the emergency department so that we could have more IDU or COVID beds. And despite that, we're having issues getting enough beds for our patients. And so what ends up happening is that, you know, we have a surge line in Arizona. So if we run out, we can ask somebody else to potentially take a patient. But that only works if there are other hospitals that have available beds. And that's only for COVID patients. If you have a non-COVID patient who needs, for example, critical care, my colleagues and I have struggled to get beds for critical patients who don't have COVID. And it's only going to get worse because, as you know, the cases are surging right now. And the sickest COVID patients are the ones who get sick a couple weeks after diagnosis, 10 days after, 5 days after, 2 weeks after. And so we're surging right now. The real hospital pressure, as bad as it is now, well, I think it'll be a couple weeks from now. And that's what's concerning.
So I think everybody realizes we have an issue here with this coronavirus, but there are still some people out there who don't believe it's a serious problem and that it's only for the elderly. You're there on the front lines. What do you say to those folks?
I mean, hey, listen, you could say that maybe this guy's not wearing pants because you can't see anything below my waist, but I'm wearing pants. COVID is real. We've got DNA fingerprinting for it. It's called PCR, polymerase chain reaction. We've been testing. This is basically the best way of proving that something exists. It exists. It infects everyone, including young people. I see young people. Like I said, I'm at a safety net hospital, so a lot of our patients are young. Now, the elderly are more likely to die. I won't lie to you. But the elderly are more likely to die of all sorts of things. That doesn't mean you act recklessly. I mean, you don't go around driving 120 miles an hour because you're young and healthy.
Right.
If you crash at 120 miles per hour, you're probably still going to die. I've had those cases many a times in my lifetime. And similarly with COVID, you can't go around acting like you're immune. I've said this multiple times. I mean, I don't know if you're a Suns fan or a Cardinals fan. There are multiple NBA players who are infected with COVID. There are multiple hockey players infected with COVID. Professional athletes are getting sick. These are young, healthy people. If they can get sick, what makes you think you're immune? It's crazy to think that.
Well, it's well said, and we sure appreciate what you have to say because you see it every single day. So we hope that you're staying safe, and we'll talk to you soon, Doctor. Thank you for your time.
I appreciate it. You stay safe as well. Thank you for
sir.
having me.
Thank you. Appreciate it.
Scotty, I love his analogies. He's like,
Totally.
boom, do you get it now?
Totally, yes.
I'm wearing pants. All right, Scotty, thank you for that.
But
Thank you
Scott
to
would
that
not
doctor.
be wearing pants.
That's
if he were at
right.
home.
But in most cases, people are. There you go.